A 70-year-old man present to his cardiologist with a shortness of breath, crackles along the lung base, and first 1 plus pitting edema in his lower extremities. His cardiologist diagnosed him with mild congestive heart failure and placed him on thiazide diuretics. 2 days later, the patient comes to the emergency department obtunded and oligouric with a highly elevated creatinine level, that is 8.3 mg per deciliter. His wife reports that the only medication that he took beside his diuretics was some ibuprofen, that is the anti-inflammatory medications, okay, antibiotic, for his headache. Which of the following is most likely the reason for this patient's sudden renal failure? So the scenario is simple, that the patient is suffering from congestive heart failure. So in order to reduce the volume overload, the patient is given and the thiazides, okay, it is a diuretic which help in the elimination of the excessive amount of the fluid from the body into the urine. So this reduce the blood volume and reduce the load on the heart. So it is one of the choice of medication for the heart patients. So the patient suddenly start to feel oligouric, okay, he become oligouric and the creatinine level sharply increase. This means there is now acute renal failure. So they said that decrease of prostaglandins E2 production in both arteriole of the kidney, decrease of prostaglandins E production in the afferent arteriole of the kidney, decrease of prostaglandin E produced in the efferent arteriole of the kidney, increase of prostaglandins. No, I think in this case what happened, when the patient takes some sort of ibuprofen, okay, it inhibit the prostaglandin synthesis into the kidney. So once the prostaglandin synthesis, this is the glomerular apparatus, okay, I made it. So once the prostaglandin synthesis decreases, it failed to dilate. So the afferent arteriole, okay, what it do, it's failed to dilate. No, it is not dilating. So what, less blood will come here, less blood flow to the renal system, less GFR. So whenever less GFR, there is a retention of waste products which have to go out of the body. So less GFR due to vasoconstriction or the lack of vasodilation due to the inhibition or the decrease of the prostaglandin synthesis, which is inhibited by non-steroid anti-inflammatory medication, that is the ibuprofen. Okay, the ibuprofen inhibit the prostaglandins. Now the prostaglandins fail to vasodilate. No vasodilation, less blood flow to the area, okay, and less GFR, which means there is less urine, oliguria, and retention of the creatinine, urea, nitrogen, and some other waste product into the blood vessel. So the answer they are asking, that which area is responsible for the production of the prostaglandins. So I stated in some books that interstitial cell, they are responsible for the production of the prostaglandins, and the afferent and efferent arteriole, both they have the capability to produce prostaglandins in order to dilate the vessel. So for me, according to me, the answer is and this book also shows this answer, that the decrease in the prostaglandins E production in both arterioles of the kidney. Thank you.